Good afternoon,
Good
Emilio.
afternoon.
You are very welcome to your interview.
Thank you for having
First
me.
of all, I'd like to congratulate you on coming this far through your training and now here at your interview. So you are welcome. So I've got a series of questions for you. I want you to relax. We're not going to ask you anything that you don't already know. In addition, if I ask you something and you're not quite sure, just ask me to pause and repeat the question.
Yes.
Okay. Now sit back and relax and we will start your interview.
Yes.
So, your first question, tell me about yourself and the experience that you are bringing into your first early career role.
Thank you. So this is how you should not answer this question. Hi, my name is Emilio and I'm a registered nurse, a newly qualified registered nurse. I'm from the Caribbean. Well, my background is I'm from the Caribbean. I have two brothers and one sister. In terms of my experience, what I'm bringing here to the role is that I'm going to ensure that I'm a team player. I communicate well with my colleagues, and that's what I will bring that's about myself and what I will bring to the role. But this is how you should actually answer the question using the STAR model. Thank you for having me, and I'm really pleased to be doing this interview today. I'm a newly qualified registered nurse who's just entered onto the NMC register, and for that, I'm very pleased. Before becoming a registered nurse, what I did is that I worked in retail for several years, particularly at Sainsbury's and Tesco in the retail department as part of their stock team. And during that time, I then went on to become an administrator in the customer service department, working directly with customers who had burning questions about products and services that we had in store. During that time, I developed quite a lot of transferable skills that I brought with me onto clinical placement as a student nurse. Those transferable skills included being a team player and also communicating effectively with my colleagues and also patients on the ward unit. I've had quite a various amount of clinical placement from community to acute, and in the acute settings, I've had placements in accident and emergency, oncology, surgical, and geriatrics. So I have quite a lot of clinical experiences of different patients and have broadened my understanding and knowledge of how to care for these patients in various different settings. One thing that I've learned is that staying calm is quite important as part of being a newly qualified registered nurse. And I say that because most recently, before I qualified, I was on clinical placement with in accident and emergency, and one of my patients that I was directly taking care of under the supervision of my staff nurse began to deteriorate and became unresponsive. Staying calm allowed me to facilitate my team members in running to get equipment from the storeroom, and also scribing, because I thought that it was a valuable thing to do during that time, just in case during that situation no one was making any sort of important documentation, that I had it handy for my staff nurse. So what I'm going to bring to this job role is being a good team player, communicating effectively, and also staying calm, because I do believe that these attributes are good qualities that a newly qualified registered nurse should have.
So your second question, can you tell us about a time in placement that was challenging and what did you learn from it?
This is a very good question. As a student nurse, I've experienced loads of challenging clinical placements and situations, but the one that really stuck out to me the most, in my last clinical placement before I qualified as a registered nurse, I had troubles getting into my EPAD, And because of this, I became very worried that I wasn't going to be able to complete my management placement. My assessor wouldn't be able to document all the assessments that's needed for me to then go onto the register. I've reached out to the pre-registration nursing team, and I reached out to my university, but no one was getting back to me on time. And this caused a lot of panic to me because I was on a retrieval placement, trying to get my work done. My assessor had gone off sick, so nothing that I've done with my assessor was not documented, and I became very worried that now that my assessor has gone off sick, nothing was handed over to my now present assessor, that I would not get anything documented. So what I did is that I reached out to the pre-registration nursing team. I reached out to my university and I awaited their instructions. But in the meantime, I brought my now current assessor up to date with what I was doing. And I also, during that time, I also ensured that I was demonstrating the necessary skills and knowledge that I needed so that I can be signed off on time with the appropriate from the appropriate person. A couple hours later, the pre-registration nursing team got back to me and highlighted that it was an EPAD issue, so I needed to get in contact with my university. So what I did, I contacted my link lecturers directly via their telephone number that they provided for me. As a result of this, what happened was my link lecturer was able to contact the EPAD team and escalate this urgency to them. My EPAD was then opened up and my now assessor was able to document everything that I needed to document so that I can finish my placement on time and without having to have any additional stress onto what I was experiencing on placement. So what I've learned from this is that being proactive and not waiting for a last minute signing off of my documentation was quite important. And what this has also taught me is that not waiting for last minute to document any sort of vital information, whether it may be patient information or personal information, is quite important. And communicating with other stakeholders such as the pre-registration nursing team and also my link lecturers is also important for me to have a safe and successful placement.